my biggest problem with the Mulago National Referral Hospital, we all know that it has two sections. That is the private and the public. But maybe I don't understand the meaning of public, because there is nothing that is free. And my biggest concern goes to the X-ray department. Even if you have got an accident, you cannot access an X-ray at a free cost. The CT scan in a national referral hospital and the public sector, you cannot. Please, kindly, this day morning, someone called me. My child is dying. He's vomiting, has anemia, but I've been told to pay 170,000. Can you please contribute for me at least something so that this boy can be operated on? Please, kindly. And another thing that I want you to investigate, I don't know if it is supposed to be like that. The fee that is paid in an ICU, that 1 million every week. Why do they have to pay 1 million in a public national hospital?
Noted.
Now, as a new minister, I also still have questions for the Minister of Health, though you are putting them to me. Like the question of charges in the Mulago and the hospitals. Because in the hospitals, from a district hospital, which is sometimes called a general hospital, upwards, the policy allows for grade A, grade B services, where you have services that are public and then private wing, where if, for instance, me who can afford goes to Masaka Regional Referral Hospital and I don't want to line up with the rest of the public, I can go to the private wing, pay, and then I am handled. That provision is there. But I have been having the same questions about charging and the exemption criteria. In Mbarara, for instance, CT scan, they told me they charge 400,000. When the media was interviewing the management, they talked of 200. Then I saw on a clip from Baram's visit, somebody complaining that the official charge is 200, but when you reach there, the workers ask you for an additional 200. So there are those issues which we are confronting. But we shall have to streamline that so that somebody who is an indigent, a poor person, should be able to get a service when he goes to Mulago.
The money that we are charging, for example, for the CT scan, is because the expense of maintenance is extremely high. The money we get, for example, to run those CT scan is far ahead of what we get. For maintenance of entire equipment in the whole country, we get, I think, up to 2.8 billion. Only CT scans, without X-ray, without ultrasound, without ICU equipment, without lab equipment, only CT scan, I need 4.8 billion per year. And that is just maintenance. But when, like now I have a machine that broke down in Arua, that it requires 500 million to replace that, but I don't have that money.